Giant cell arteritis, also known as temporal arteritis, is a form of vasculitis that primarily affect the large and medium-sized arteries, especially the branches of carotid artery. It is systemic inflammatory disease that can lead to serious complications, including vision loss, if not diagnosed and treated properly. This disease is common in the Caucasian, common in female, ratio is 3 to 1, and most common in over 50 years of age. Pathology of this disease is related to immune mediated process, that is mainly activation of T cells and vascular changes in the tunica media, which lead to multinucleated giant cells in the tunica media that may lead to inflammation. Clinical features. The most common is the headache, which is temporal, severe, and recent onset. There is scalp tenderness in the area of the temporal artery. There may be jaw claudication, visual symptom like diplopia, transient vision loss, or permanent vision loss may be there because of optic neuropathy. And systemic symptom may be like fatigue, weight loss, fever, night sweats, and malaise may be there. Diagnosis require clinical evaluation, thorough clinical history, and physical examination, including palpation of temporal arteries, tenderness, thickening, and reduced pulsation can be seen of the temporal artery. Laboratory tests like ESR elevated more than 50, C-reactive protein should be elevated, and complete blood count should be tested. On imaging, USG, there will be halo sign on the vessel wall on local area. MRI may show large vessel involvement. PET scan can detect inflammation in aorta or major vessels. And temporal artery biopsy is the gold standard test for temporal artery arteritis, which show granulation inside the tunica media with multinucleated giant cells may be there. The diagnostic guidelines set by American College of Rheumatology include presence of any three of the following five criteria: age of onset more than 50 or equivalent to 50, new headache, temporal artery abnormality like tenderness, nodularity, elevated ESR equivalent or more than 50, and positive temporal artery biopsy is suggestive of giant cell arteritis. Treatment include corticosteroid that should be given 40 to 60 milligram per day. You can start with prednisolone or methylprednisolone. Second therapy is steroid sparing agent like methotrexate or tocilizumab that can be given in steroid contraindicated cases or relapse cases. Third therapy is aspirin. Low dose aspirin may be used to reduce risk of ischemic complications such as stroke. Fourth is monitoring and prevention. Regular ophthalmological examination with vision examination should be done, and you can give bone protection like calcium, vitamin D, and biphosphonate therapy. And you should monitor the side effect of corticosteroid, glucose tolerance, hypertension, osteoporosis, which is related to the corticosteroid therapy. Complication of temporal arteritis: vision loss, aortic aneurysm, dissection, and stroke. These are the three complications. Prognosis: with prompt diagnosis, generally prognosis is good. But in long-term cases, you need to monitor the disease recurrence and manage complication with associated corticosteroid side effects. In conclusion, giant cell arteritis is a serious, potentially vision-threatening condition that requires prompt recognition and treatment. High-dose corticosteroids remain the cornerstone of the therapy, and early intervention is a key to prevent reversible complications. And it's required multidisciplinary team to tackle the cases.